Hello, welcome to Podsongs. I'm Jack Stafford, and I interview inspiring people in service to others as inspiration for a new song. Today I'm speaking with a Spanish physician, international civil servant and diplomat who served as the Director of Public Health at the World Health Organization since 2005, and her mission is cleaner air. Please welcome Dr. Maria Neira.
Hello?
Hello, Maria.
Hi, Jack. How are you?
Very well, thank you. How are you?
Nice to meet you.
Nice to meet you too. Thanks so much for taking the time to speak to me.
Pleasure. You are something different in my working day today.
Yes. Not many times people contact you to write a song about you.
And, it's so nice to be in touch with an artist, at least. That changed a little bit my life.
No, well, you're doing great work. You're mostly focused on
Thank
clean air, from what I was reading about. And just coincidentally, I was reading a magazine just before we came on, and I turned the page, and it was a story about Ella Kissi Deborah in London, who died from. She's the first death from an inquest in London, in England, to death by air pollution. Do you know about this case?
I know very well the mom, Rosamund, and the twins, the brothers of the little Ella, and it's an amazing family. And Rosamund is an incredibly strong woman, and she put a lot of effort on what she did, and she managed now to have an historical sentence that we will all use now, because it's amazing what she did and she's doing.
Because in your videos you talk about 7 million deaths every year, and I mean that's that kind of number, and you kind of think maybe it's old people or people in developing worlds in China, for example, but this really brings it home when there's a death from a young person in London. She was only 9 years old.
Yeah, and I think one of the big connections with this problem of air pollution is exactly that, is asthma. I think people understand that very well because you feel it, and then everybody knows somebody with asthma, and everybody knows how terrible it is when you cannot breathe properly. I mean, when you... I don't know how many asthmatics you saw in your life, but when I was a practitioner, for me, it's one of the most impressive things, when you have somebody with a very acute attack of asthma and they cannot breathe. Wow, that's really very, really terrible. Yeah.
So how did
air pollution? Yes.
So maybe let's talk about a bit about this case. Was it the nitrogen oxides that cause the most damage? How is it so dangerous?
Well, the problem is that this little girl and her family, they were living in a very polluted area of London. So again, you see the so-called social determinants. You can live on an area where if you are poor, probably the levels of pollution are even higher. So she was treated at hospital, and her asthma attacks were stabilized, but then she was sent back home where she was exposed to NOx and she was exposed to PM 2.5. And so the problem, the cause of the problem was exactly the same. And nobody had the initiative on saying this girl needs to change the place where they live, or the conditions of the places where she lives needs to change. And so this is an open, it's a good advocacy what is doing now, because people now is very much aware of what air pollution means for your health.
So the mother said she would have moved away if she'd known. I mean, it's not every child that's affected this bad, is it? She did have quite an acute case.
I think that's the problem. Is if you as a doctor, you keep treating the disease, but not looking at the causes of the disease, this is really very frustrating, because we as a doctor, we cannot simply perform our work at the hospitals. We need to influence what's happened outside. And we need to make sure that we treat patients when they are sick. But more importantly, we need to make sure that they will not become sick. And we need to do more on preventing diabetes, preventing hypertension, preventing exposure to air pollution, preventing obesity. That will be preventing tobacco, of course. That will be a fantastic way to keep people healthier and promote more well-being. And in the case of air pollution, that will be so good as well to prevent pandemics like the one we are facing now, because more your lungs are vulnerable, more an infectious respiratory agent like SARS-CoV-2 will be able to have an impact on you. That's clear.
I had a song about one of my other guests I wrote called Doctors Unite. I'm trying to get the remedies universal for many health problems, that if doctors just come together and are activists as a group, they can solve all of these problems, no?
Yeah, I will love to be part of a white coat revolution, a positive white coat revolution. I will be so happy to be there. The doctors, we are upset. We are fed up. Doctors are, we are losing patience now. We want you to clean our air. I want to clean air. I will do a rap, and then try a revolution saying, come on, guys, come on, doctors, join me. That's enough. Patients out of the clinics. We want people healthy, not sick people. So even if we lose our jobs, we want you healthy, guys.
Yeah, white coat revolution. That's great. So what? So do you think
white coat power?
Yeah. So do you think that COVID has taken too much attention now away from? I heard you talking in another video about how dangerous, for example, even an obscure thing like lead poisoning is still affecting so many people. But now, do you think we're over focusing on one health issue now with COVID?
Yeah, if COVID can bring to us this, can reinforce this importance of prevention, that will be a big achievement. If he kind of wake up us and say, okay, unless you reduce your vulnerability, you will be, exposed to new crises. It can be a virus, it can be a climate change, it can be an environmental issue. But you need to understand that we are very vulnerable, and we need to do whatever we can to reduce that vulnerability. And one way to reduce our vulnerability is to stop polluting everything we touch, because we are the polluters' army. I mean, whatever we touch, we pollute it. We pollute the oceans, and therefore the food that we obtain from the oceans. We pollute the air we breathe. We pollute the water we eat. We pollute the soil where we do our agricultural products. Everything we touch, we pollute it. So unless we understand that by reducing pollution, we are not saving the planet. We are saving ourselves. I mean, the pretentious people who says, let's save the planet. Who do you think you are to save the planet? The planet will do this and we will all disappear. So we need to make sure that the planet will accept us as predators that we are. But at least we will be accepted, and then we have a nice way of living together and taking advantage of nature instead of destroying it.
It's so difficult to change, though. I mean, for example, with COVID, the people who are very vulnerable, the people overweight with diabetes, I know some of them personally, and they haven't changed their behavior even when they know that that puts them in a risk category. So changing the world,
Yeah, this is very, very interesting, because when you see what the society has been able to do to prevent COVID, we are all with masks, universal use of masks. Who will imagine anything like that? We are all staying at home. We are all, refraining from seeing friends, from having a big hug and all of that. But If you ask the society to stop smoking, no, that's too much. And then they will accuse you of, attacking my personal freedom, and there might have some economic repercussions. Wow! But for COVID, we have been able to do everything, and including a horrible economic disaster that will be very much attacking us soon. So it's funny that we need to put on a package all of those huge risk factors that are going against ourselves: so, obesity, sedentary lifestyle, tobacco consumption, and air pollution. We need to, and the diet, what we are eating, which is related to obesity, that will be such a healthy society and well-being, and still maintaining our freedom, of course, but on the choice, but good choices, not bad ones.
As of today, 2.27 million people have died with COVID. And if it's 7 million from air quality every year, but there hasn't been a national emergency, I mean, how does that make you feel?
It's terrible to compete in terms of numbers of deaths. I mean, here in WHO, we are responsible for issuing this type of figures and saying how many people die from air pollution, how many people died from tobacco, how many people die. So it's not a competition. It's a horrible competition, by the way, in terms of millions of deaths. So every death is a painful one. Even one death will be too much if we can prevent it. So we need to accept the death, of course, but we need to prevent when it can be prevented. So I feel very bad about not providing enough attention to air pollution, particularly because that will be contributing as well to reduce the probabilities and possibilities to get COVID-19 as well. So we could reduce a lot of damage, and that will be a good investment because it will be on the prevention of COVID, on the prevention of the 7 million deaths, on a more sustainable and an economy, good economy. So there will be only wins around that.
Do you think there was some side benefits with COVID? I mean, I live by a road. It's quite busy, and during the first lockdown, was the first time we could go. We went and sat in our garden, because there were no cars coming by in our front garden, and it was great. And there were no airplanes going overhead, and and people in the cities were all wearing masks. So do you think the deaths this year from air pollution will be less?
We saw it. We saw it in the first weeks, and I think people appreciate enormously the lack of pollution, the lack of noise, the lack of traffic, and the fact that you could walk and the city was a little bit more human. But unfortunately, those benefits have disappeared already. In terms of CO2 emissions, we are back on the wrong track again. And maybe the more sustainable benefits will come from people who will prefer now to move to rural areas or outside the city, and then our cities might be less dense and populated, but we'll see. I hope so. I hope that the families with the small children might look for other options outside the very congested cities, and then we will have a better rural life and more friendly and with a piece of garden somewhere.
A friend of mine in London said that now because everyone's been used to working from home, teleworking, and so many businesses are used to it, and they realize that the productivity stays the same, and it was kind of insane if you look before that everybody rushed at the same time in their cars to work, and then at the same time rushed home, causing this huge. If we can change that somehow, that would be great.
Yeah, I think we all realize that we don't need to all be in the office at 9 o'clock and leaving at 5. That sounds ridiculous now. And how many people accept it and without any question, spending 2-3 hours a day on queuing in a car and in the traffic. We all thought that it was normal, and we didn't complain. To go to an office where you have one chair, one desk, and a computer. So in fact, unless you have another type of work, you can do it in other places. So we need to manage to have something where we have social interaction, because that's very much needed, I think is so important. But it's still a more rational way of living and working. I'm receiving now emails from my colleagues at 3 o'clock in the morning, or I mean, you can work. I mean, 3 o'clock in the morning is not a good thing, but I mean, people change their way of life, and maybe they take care of the children during the day and they work later on. So there are some positive, but still, I think I miss terribly the social interaction. That's
Zoom
the
gloom.
human touch, fundamental.
I was reading one of my other guests. One of my other guests was a sleep doctor, and there's different types. The wolves and the dolphins, they stay up late at night, so maybe they benefit from this different work schedule, and they're actually more productive. And
but provided you can see human beings in 3Ds, in 3 dimension, and see that not only the screen, that I hope that we will not go back to what we had before, but we will have a more funny way of working and living. I'm pretty sure that it will be the case.
Well, fingers crossed, but we have a history of going towards insanity. I was watching with my niece and nephew a film called The Lorax by Dr. Seuss. Have you seen that one?
No.
It's set in
Say the name.
The Lorax. Yeah, and it's set in the future where you have to buy your air clean. We live in a sealed city, and you have to buy your air as people buy bottles of water now, which is also insane.
Oh yeah. But you know that in India, in New Delhi, there are bars already where they offer you oxygen masks for breathing a little bit of oxygen, and then this is kind of funny.
It was a fashion thing, supposed to make you feel good. But I tried it once when I was traveling in Asia, and it didn't make me feel any different.
Oh, you try it and
yeah, it's a fashion thing. Yeah,
crazy. Yeah, totally.
So, do you cycle in the city?
So, what are your plans?
My plans?
Sorry, I interrupted.
Sorry, with a bit of a delay there. But do you cycle in a city? Do you live in Geneva? Is that right?
Yes. No, Geneva is we are so privileged in Geneva. Well, to be honest with you, I cycle, but 7 months a year, 5 months. I mean, the winter time, no. But the summertime here is so easy. Everything is easy, honestly. We are very privileged in terms of nature and landscape and the lake. Everything is easy. So it's true that when you live in other cities, it's more complicated. But here, you don't have excuses, and you have to enjoy the nature. Yes.
Do you think that's right? Do you think that's right to put the World Health Organization in such a wonderful place? Shouldn't they put it in like a terrible slum in the worst area? They'd be more motivated.
Probably, yes. But this is the type of life where we should all promote, no? They don't have big constructions here. They have they are very respectful with the environment. They are very respectful with the lake. I mean, in general, with all the facilities. So maybe this is the model. But I've been living in many horrible places. So in WHO, yes, we have a big office in New Delhi. So my colleagues knows what air pollution is. And we have offices in many countries in Africa. And I've been living in refugee camps for years. So I know what living in a slum or a less privileged place is. Yes.
So you were, before you joined the World Health Organization, you were a medical coordinator with Médecins Sans Frontières. You were in refugee camps in Salvador and Honduras during armed conflicts there. So that was the other extreme. How was that?
Oh, it was one of the best experiences of my life, not because I enjoy and see people in difficult situations. It was from a human point of view. It was really very, very tough. But in terms of helping me growing and understanding the world and deciding what I wanted to do and how I could contribute as a doctor to the huge challenges we have. It was very, very impressive. And then you see that the good part of everything, in the refugee camps, you can find amazing people in the middle of such a horrible situation. They still have this resilience and this passion to go to a better life. And it was really an amazing experience. I've been really very lucky to have the opportunity to contribute a little bit to those humanitarian situations. So this is one of the best experiences of my life. Yes, I was at the border between Salvador and Honduras during the guerrilla times, and on a refugee camp that was very closed down, surrounded by army from Honduras. So very tough. But I was very naive as well at that time. So probably that helped me not to see the dangers around. But I survived.
How old were you at that time?
I was 27. It was just after I finished my specialization in Paris. So I was really young, and you arrive with your kind of genuine and naive and thinking that you will save lives. And then this is what I tried to do. But then I realized that it was more about preventing death and while you save lives. But the best way to have an impact was the prevention, exactly. So we put a nutrition program in place. We put a training program for women, helping us to take care of pregnant women and learning hygienic things, and then preventing from food poisoning and preventing from air pollution, because people were cooking at home and then they were inhaling this horrible combustion. And so it was fascinating. And then for me, this is where I did my public health training. Not in the school in Paris or the university in Paris. It was on a refugee camp in Honduras.
Wow.
For sure.
So you were drawn to that, and even then you were looking at not solving the problem and not just fighting the fires.
Well, it took me very little to see that, because I was receiving a child with diarrhea today. You treated the diarrhea, you send the child back, and 3 days later he comes back with diarrhea. Or with asthma, and you send it back home, you treat the case, and then they come back. So it took me 2 or 3 times to say, okay, what the hell is going on? Why so many cases of diarrhea? Well, you go there and you see why they have diarrhea, and no hygiene, no soap, water, sanitation issues. So you try to then put your efforts there. And the asthma, the same. I mean, we negotiated with the UNHCR, who was in charge of the camp, to have a different fuel for cooking, and then having common kitchen, and then avoiding all of these individual fires at the household level, and then all of this smoke every morning. It was at 5 o'clock in the morning, they were starting to put this fire operating, to do the tortillas, the little bread they do in Latin America with corn. And it was horrible. You could see the smoke in every single little house, piece of wood. And that was dramatic. So we put a common kitchen, much effective in the combustion. So, and instead of having all of this smoke, we reduce it substantially. I think less than 20% of the smoke that we have it. So the number of cases of asthma went poof like that. It was so beautiful. No, that was very obvious. Instead of having all of this smoke and individual exposure, you have these open kitchens with improve efficiency on the combustion of the fuel, and then ventilation, and the women were there, but not all the time with the children, and it was an open space. So the number of cases of asthma when I left was almost zero.
Well,
the chronic.
How did you do that? I mean, you were 27, you're fresh out of school. How did you, this young lady, convince these people to change this, to get this infrastructure and get this stuff brought in?
I don't know. I think difficult situations give you an increase of creativity, And another thing I did, well, we were a team, but we have something amazing, which was our passion for what we were doing. And, you spend the whole day there, so you have ideas for sure. So we did, for instance, we had a lot of people suffering from mental kind of, when you are close on a refugee camp for 7 years, for some of them for 7 years, they didn't go out. So the mental health issues and we have a lot of cases of psychosomatic. They were not sick. They were feeling disease, but not sick. So we did, we create we put plants to, like, how do you call it? It's medicines type, homeopathy. We put some plants to grow, and it was a kind of therapeutic approach because the old people started to cultivate those plants, and then it was medical treatment. It was just plants sort of for relax and then diuretic and things like that. So it was nothing, but it was psychologically they were all occupied. They have an objective. They feel better, and then with all of those medicines and plants and all of that, we were doing teas and tisanes and nothing, but it had an incredible effect. And then the nutrition training was very effective as well. But, Médecins Sans Frontières is very much the platform that stimulates all of these things. So it's good. It's good.
Wow. Yeah. Because on another show, I had guests who volunteered in Greece to help the refugees there, mostly from Syria. And they said it was terribly frustrating to do anything with the NGOs, that there was bureaucracy and people stuck in camps, all burning fires, like you say.
Well, I suppose it depends very much where you are and how much space you have and how much space you want to take, because I didn't ask anyone. At that time, we were just pushing. So it depends. It depends where you are and how much you are conscious of the power you can have in terms of, as an international institution, but maybe in Europe is different. I never worked on a refugee camp in Europe. I suppose it's different. In Africa,
I heard it's a problem when you apply first world European, your first world way of working to an emergency situation. You'd have any different rules for that, no?
Yeah. That's that's why I say I never worked in Europe, but I'm sure the conditions are totally different. And it's very much focused on the legal aspects of your status, whether you are a migrant or you have the right to be considered as a refugee, and then you can apply for a visa. On the refugee camps in Central America, it was more a question of, it was very politicized, of course, because it was the war and a lot of influence from the States at that time. But still, in terms of assistance, it was basic assistance in terms of food, medical assistance and protection. And then it was up to you to be creative and see what else you can contribute to. But if you just to do your work and you provide medical assistance, then that's all. You fill your curriculum saying that you've been in Africa. Things have changed a lot since I was there, and how the humanitarian work now, things have changed a lot.
It just makes me wonder with this, people, they stop thinking. Ella Kissi Deborah went to the top specialist, doctors in London. That's the centre of medicine and 27 times, and they didn't inquire and get to change her style. And you in El Salvador or Honduras, you after a few times you work with people and you go to their homes. And
I think it's a question exactly, but in the refugee camp in Honduras, I was forced to do surgery. I did helping women to deliver, even on a very complicated delivery, things that I will never do in Paris. You think that at the hospital where I was trained in Paris, I never touch. Imagine me doing surgery without, that was for the surgeons. I was endocrinologist, so you don't touch the patients and it's hyper specialized in Europe. On the rich countries, medicine is hyper specialized, which is good because we have a hyper specialization for each of the things. And then you work very much on a very confined environment. So the hospital, so you provide cure, you provide treatment, but you don't rather have the time nor the authority to say, okay, let's get out. It's very frustrating when you see doctors treating the children obesity and then recommending diet or recommending treatment, but not saying, where do you live? Why this boy is not going down and play football with his friends, and move a little bit around? What is this boy doing? And maybe sitting for 10 hours in front of a computer playing PlayStation. Maybe the parents will say this is not your business as well. So rich countries, we have different standards. So I understand those doctors, maybe, it depends in which context. And then at the Faculty of Medicine, they do not train us to do prevention. Huh? They train us to deal with disease, not to deal with health. It's a battle that I have very often with my colleagues here in the World Health Organization. I say, remember that we are called World Health Organization, not World Disease Organization. So we don't take care of the diseases, we take care of health, and health means preventing the diseases as well. So that's the World Health is so beautiful, but it's so big. Yeah. So I don't want to be a World Disease Organization. I want to be a World Health Organization. And every doctor at the hospitals, they should not be the treatment, the doctor who treat diseases. It should be the doctor who take care of the health of the people.
So your role now is you're Director of Department of Public Health, Environment and Social Determinants at WHO. What does that mean then? What do you do on like a day-to-day basis?
It's exactly that. It's preventing all of those risk factors. So I work on the prevention of making sure that certain chemicals, we look at them, we see whether they have an impact on health, we do an assessment. Once we have our results, we do awareness for reducing that. We look at which conventions need to be changed to reduce the exposure to lead or to mercury or any of the toxic metals that we still have around. Or we are very much on the e-waste, the electronic waste that is representing yet another problem. We look at lack of water and sanitation and hygiene. We look at radiation exposure. We look at air pollution, climate change. All of those things are affecting our health. And where do we need to put our fingers to have the maximum possible effect on the prevention of exposure? So it's fascinating.
Oh, wow. So you look for all these... Yeah, well, you must have to keep up to date with everything because there's these new pollutants coming out all the time, these new issues.
Yeah, this issue of electronic waste, you can't imagine. All of those, our old computers and all car batteries containing a lot of lead ending up in big mountains in Africa or in Asia where you have a woman with the little child on her back recycling all of those little pieces that can still be sold, and maybe spending 10 hours, 12 hours there, exposed to those heavy metals to collect a few grams of something that will be sold, and maybe for which she can get $5 a day. So the levels of lead in blood of the children exposed to that for months, when you look at the books and say what is the normal and the one that will not kill you, you say, no, these books are wrong because the concentration and the presence of in the blood of those children of those metals is crazy. And this is affecting our IQ
Oh, yeah?
very much. development. Anyway, so, but we still need to be optimistic. Come on.
And what about electric cars? I had that discussion on another show because they're better for the air, better for the lungs. But is there going to be problems with the recycling of all these electric cars?
But this is the thing, when we talk about sustainable development, we have to do it on a very comprehensive way. Remember when the diesel cars were promoted because they were environmentally friendly in terms of CO2, but nobody thought that, okay, maybe, but they are bad for our lungs. So that's why I want to put the health in the middle of this debate. If you do it, all the assessment of the impact of any intervention you have on a comprehensive way, but you put health in the center, then we will have less mistakes like the one on the diesel cars or now the on the electric cars.
So what's your opinion of electric cars? They're probably coming inevitably, but is it for the better or for the worse?
I hope it will be for the better. It has to be, but we need to look at this issue of the batteries and the recycling and from where particularly the recycling of the batteries. But I'm convinced that the private sector, if you give them a good business case, they will come up with a solution. But we need to put pressure on them to say, okay, this is irreversible now. Diesel cars and fossil fuel cars, they need to get out of the business. So give us a better solution, but a solution that is broad and goes until the end of the problem, not just the little piece that we need at the moment.
So your work, do you influence governments, or can you do legislation for affecting companies? How do you put pressure?
Whoever accept our influence, and even if they don't accept it, we try it. So yes, governments, of course. Private sector, big companies, individuals, activists. We touch on all the places where we can have an influence. People like you. I mean, everything is useful. Journalists, the big politicians that might have an influence on the public. So wherever we can have an impact.
Quite a few of my guests said, maybe you could check this for me, that the recycling initiatives were actually created by the plastic companies because they wanted to push the burden of responsibility onto the end consumer. Is that true?
It's partly true, yes. It's partly true, and it proves how the private sector always have a very good solution and a good strategy, So if we put them in our side at the beginning, when you have a problem, say, okay, guys, we are not just attacking you and making you responsible. No, you need to think with us how we will solve this problem. And the Coca-Cola guys, they always say, oh, we don't sell sugar, we sell a drink. So, but your drink is full of sugar. So, but we can play differently. We can reduce sugar. And okay, let's discuss that and then tell me how do you want to do it. And then the plastic issue is another one. And then so unless our citizens are perfectly aware, they know what are the issues, and they keep putting pressure on the governments, but as well on the private sector, saying, no, I am not consuming Coca-Cola if you don't give me a better better solution for the bottle, or I will not consume Coca-Cola because I understand that it's full of sugar and this is very bad. That's why a lot of education of our citizens is so important.
So what can we do as individuals? Should we just change our behavior, or should we join any organization? Should we write to politicians? What's the most effective way we can act?
All of them. I mean, of course, we need to change our behaviors, because the pollution we are on it is because we are, all of us, adding a little piece of pollution. But there are certain things that you cannot, as an individual, change. Like if you live in London, I mean, you have to breathe the air that is there. You cannot choose and say, no, today I'm breathing the air of the mountain in Kathmandu. No, you have to breathe whatever is available. So we need to vote, and we need to make sure that our politicians respond to our demands. And we need to be activists and create groups and put an emphasis on raising awareness and engaging with others. My mission now is make sure that any single pediatrician in the world, any single doctor specialized on lungs or cancer or any other specialized doctor join me and join this cause. No, fighting for clean air. I mean, it's ridiculous to fighting for clean air. It should be a basic thing, water, food, and air. What else? I mean, if we cannot have clean air. But we need to fight for that. So I want all the health professionals protesting and really raising their voices and saying that, come on, this is ridiculous. We need to change, all of us. But we need to change laws. We need to change the way we live. And we need big changes in terms of the use of the sources of energy that we have now, which are really killing us.
Yeah. Do you know if you spoke to the doctors of Ella Kissi, Deborah? Did you ever, those pediatricians?
Yeah, we have big networks of cardiologists, pediatricians, health professionals all around the world, but it's never enough. We need them to raise their voice more and more and more. There is one doctor who was intervening in the Ella case, and he was amazing. He was really, really good. Don't remember his name now, but he's the one who intervened at the court, and wow, he was really amazing.
That's a landmark case, yeah.
Absolutely. So good.
Wow, this has been a great chat. I mean, I think we covered so much. Is there anything you think that we didn't cover that you'd like to?
No, I'm happy like that. So what are you doing now? Tell me, what's your what next?
Well, I have to lie down with a fan over me, with getting fresh and cool air, and try and get inspired to write a song to send out your message to the world.
Fantastic. You see, you are my activist.
Yeah. Yes, that's fantastic. I mean, I really appreciate it, because your inbox must be...
Music can move mountains. Huh? The music can move mountains. So if you do a funny song, we'll see, we can move mountains. So I hope it will be the case. I trust you.
Oh, well, you've done your bit. You've provided the inspiration, so the rest is up to me.
Wonderful. Okay. So, Jack, we keep in touch, okay?
All right, definitely.
Let me know. Wonderful.
Thanks so much for the chat and for everything you're doing. It's we're so lucky to have people like you.
Same here. Thanks for what you are doing. Thank you very much. Bye. Ciao.
Bye, Maria. Ciao.
Bye.
Reading in the papers, numbers written there of how many die each year 'cause of dirty air. Numbers, they don't speak to you, trauma they lack. Unlike the sound of hearing someone die from an asthma attack. What can change so that Ella Kissi, Deborah didn't die in vain, and we all take action. Change. Ella Kissi, Deborah, hear our prayers, so that no more children will die from breathing air. Ella Kissi, Deborah deserves a happy tune, but this song's not meant for meant for you to pluck and play your heartstrings, so you think twice before you drive and decide who you will give your vote to, so more kids can stay alive.
Well, thanks for tuning in. A song can make a difference, but so can you. Think before you drive. Think which car you buy. What kind of heating you use in your home. We can all make a difference. And thanks to my musicians, Maurizio Sarnicola, Massimino Vozza, and my researcher, Dori Verbo. Please check the song on iTunes, Spotify. Share it, share this message so that more people can hear it. And, well, rate and review on your podcast app. Do everything you can to help promote the show and help our guests to spread their messages. Thanks. Until next time, have a great day.